Hello and welcome. My name is Dr. Henry, and in this video, we are going to demonstrate the signs of meningeal irritation. We are going to start by explaining some of the theories you need to know before demonstrating the signs. Then we'll go ahead to demonstrate the signs properly. Now, meningeal irritation occurs when the meninges, which are the protective layers around the brain and spinal cord, are inflamed. So this inflammation causes some of the physical activities which we perform to lead to the stretching of the inflamed meninges, which we are going to observe. So some of the causes of meningeal irritation includes things like infective meningitis, subarachnoid haemorrhage, maybe chemical meningitis, or any form of meningitis at all. So anything that causes any of these meningitis will lead to an inflamed meninges. Now, to demonstrate or to find out if the meninges are actually inflamed, we use three physical signs or three physical demonstrations. So we call them the classical triad of meningeal signs. They include Nuchal Rigidity, or what we call neck stiffness, the Kernig Sign, and the Brudzinski Sign. Now, these signs are not actually demonstrated for infants less than 18 months because these classical signs are often absent. So for infants less than 18 months, you can use other signs like bulging fontanelle, irritability, or poor feeding, high-pitched cry to determine if there's meningitis or not. But from 18 months and above, when these signs are present, we can actually use it to confirm if the meninges are actually inflamed. So like I said, the three classical signs, the first one is neck stiffness. So this is resistance to passive or active neck flexion. This occurs because of the reflex spasm of the neck muscles when the inflamed meninges are stretched. So during the neck flexion, the spinal meninges are stretched. So if it is inflamed, there will be pain during the stretching. And this will cause reflex muscle spasm, which prevents the movement. So during the neck flexion, you might feel resistance or spasm of the muscles of the neck. The second sign is the Kernig Sign. In Kernig Sign, we will start by flexing both the hip and the knee to 90 degrees. Then we'll start extending the knee, which will also cause stretching of the inflamed meninges, and there might be pain and resistance. So that is simply what Kernig Sign is all about. Then after Kernig Sign, we'll also demonstrate what we call the Brudzinski Sign, where we'll try to flex the neck. Now during the flexion of the neck, there will be involuntary flexion of the hip and the knee if the meninges are actually inflamed. So these are the three basic signs or the three classic triads which we use. Like I said, use this only when the patient is 18 months and above, because when the patient is less than 18 months, these classic signs are actually absent and you might not be able to get the accurate results. So we are going to go ahead now to perform the physical examination. Now, like we said, before you perform any physical exam, we have the pre-exam, the examination itself, and the post-exam. Now in the pre-exam, you greet your patient, you introduce yourself, then take permission from your patient, then you perform your hand hygiene. Then in the post-exam, you will thank your patient and probably explain the results to your patient, depending on the exam. Then in the examination itself, you perform the full examination itself. So the pre-exam and the post-exam are constant for any exam, any physical exam you ever take. So we'll start with the pre-exam first. If you found this video helpful, please drop a like, subscribe if you haven't already, and turn on your notification bell so that you don't miss the next one. Also share this with your friend who might need it. Hello, good afternoon.
Good afternoon.
My name is Dr. Henry, okay, and I would like to perform some examination on you, which will involve me touching your leg and probably raising your leg. Can I go ahead?
All right.
Right. So then you perform your hand hygiene. Okay, we'll start by checking the neck stiffness. Now there are two techniques to this. You can ask the patient to actually on their own try to flex their neck. Okay, so can you use your chin to touch your chest? Okay. So you can do that, or you can actually do it passively yourself, okay, where you place your hand on the patient's occiput and then try to bring their chin towards their chest. Okay, so for our patient, there's no neck stiffness and there's full range of motion with flexion with the chin touching the chest. So this is normal and there's no meningeal irritation. But if there was meningeal irritation, the flexion of the neck would be very limited and there will be spasm of the muscles of the neck due to irritation of the meninges during the flexion of the neck. So that's that for neck stiffness. So the next one is the Kernig Sign. So we're going to flex simultaneously both the hip and the knee before we try to extend the knee. So remember the first step, you flex both the hip. Okay. Please can you release your leg? Okay. You flex both the hip and the knee. Okay. Then now that it's at 90 degrees, both of them, then you try to extend the knee. Okay. You try to extend the knee, okay, while looking at the patient. So if you feel any discomfort, you tell me, okay? If the meninges are actually inflamed, there will be resistance in this movement and there will be pain. Patient might cry out of pain, okay, and you stop. So if there is any irritation or meningeal irritation, or if there is an inflammation of the meninges, you will not be able to perform this. It will be with resistance and there will pain the patient. But for now, as you can see, Kernig sign is negative. Okay, so you also test that for on the other leg. So flex both the hip and the knee first. Then you try to extend just the knee. Okay. So as you can see, the Kernig sign is negative bilaterally. There is full knee extension achieved without resistance for pain. If you found this video helpful, please drop a like, subscribe if you haven't already, and turn on your notification bell so that you don't miss the next one. Also share this with your friend who might need it. The final one is the Brudzinski sign, where we'll try to flex the neck. Then while doing that, we'll watch the leg. So while doing the Brudzinski sign, you have to watch out for the lower limb, okay? It will be positive if during the flexion of the neck, it causes immediate bilateral hip and knee flexion. So due to resistance, first you put your hand under the patient's head, then probably place your other hand on the chest and try to flex the neck. While flexing the neck, to watch the lower limb, okay? Now, if there's meningeal irritation during the flexion of the neck, the patient might involuntarily flex the knee, probably, and flex the hip and the knee too. So, but in this case, there is no flexion of the hip and the knee when we did this, okay? So this shows that there is no sign of meningeal irritation. Brudzinski sign is negative. There is no involuntary leg movement with passive neck flexion. So with this, we'll come to the end of our examination. So we'll thank our patients in our post-exam. Okay. Thank you very much.
You're welcome.